Everyone, welcome to researchmd.com. Another great presentation today. We are going to look at an important drug called Metformin and look at the adverse effect or the complications of that drug called Metformin. So what do we use Metformin for? Like usually people, when you have diabetes or high blood sugar, especially type 2 diabetes, we use Metformin. If you look at Metformin history, there's at least 100 million prescription drugs were written in 2020 alone. But the cost-wise, I think it costs for one prescription probably $10. Very cheap drug, but it's a good drug to treat diabetes. Now we're just going to go look into what complications it can cause. Okay, number one, that's each system we're going to look at it. What's the number one problem we always worry about when we start a drug? Can it cause cancer? Let's look at the cancer. So good news on that. Metformin do not cause cancer. It does the opposite. Okay, Metformin can decrease the chances of having a cancer by like 23%. So in that category, so if you have diabetes and if you're taking Metformin, it can decrease your chances of blood sugar by almost, it can decrease the chances of having cancer, especially pancreatic cancer, by like almost 25%, remember. So that's good news. Let's look at the other system. Let's look at the kidney, okay? What happens in the kidney? Very, very important. Kidney, it started producing lactic acid. Normal lactic acid between 1 and 2. In this case, lactic acid can go up to like almost up to 5. So what happens when you have like a lot of lactic acid in the body? Blood can become acidotic, okay? So it can cause metabolic acidosis. We use the term lactic acidosis. It's a life-threatening situation. I have seen that it happens many times. So be careful. When you go to the hospital, have some complications, you better go check it out for, does it cause lactic acidosis? Can it cause kidney failure? Especially the people, if they have kidney failure, you have to adjust the dose. We can worsen the kidney failure. It doesn't usually cause that much kidney on its own, but if you have kidney failure, like a chronic kidney disease, you have to adjust the dose or you should completely stop it. Okay, there's some limitations. It depends upon what stage of your kidney disease you can take it. So usually it's not a good idea. It can make the kidney function worse. Okay. Now, then let's look at the other system, the heart. What does it do to the heart? It can cause chest pressure, and it can cause palpitations also sometimes, okay? And the other major organ we have to look at, the abdomen or belly. What does it do to the belly? It can cause abdominal distension, abdominal pain, and it can make abnormal stools also. Your stool pattern may be different. Dyspepsia, you can have heartburn. That's also very common in these people, okay? And the endocrinology cause, like when you look at the endocrinology, of course, endocrinology, it does bring your blood sugar down. That's why we use it for diabetes. That's not a complication, right? But what does it do? It causes vitamin B12 level in your body goes down. So it can cause vitamin B12 deficiency, okay? When you look at dermatology in the skin, it can cause like diaphoresis. When you look at our nervous system, it can cause dizziness, headache, okay? Remember that. When you look at our musculoskeletal system, it can cause muscle pain. When you look at our respiratory system, it can cause upper respiratory symptoms. It can cause shortness of breath. Those are very common. So overall, two things you always have to remember is what? Metformin can cause life-threatening lactic acidosis. Be careful when you use it in the renal failure, and the other thing about the metformin can cause vitamin B12 deficiency. It can have like long-term complications. Okay, thank you so much for watching. We'll be back with another presentation soon. God bless.